A heart attack is the death of a segment of heart muscle caused by a loss of blood supply. The blood is usually cut off when an artery supplying the heart muscle is blocked by a blood clot. If some of the heart muscle dies, a person experiences chest pain and electrical instability of the heart muscle tissue. What are the causes of heart attack? 1. Smoking. Smoking cigarettes makes the walls of your arteries sticky from the chemicals, so fatty material can stick to them. If the arteries that carry blood to your heart get damaged and clogged, it can lead to a heart attack. 2. Abnormal cholesterol. When there is too much cholesterol in your blood, it builds up in the walls of your arteries, causing heart disease. The arteries become narrowed and blood flow to the heart muscle is slowed down or blocked. 3. Diabetes. Over time, high blood glucose from diabetes can damage your blood vessels and the nerves that control your heart and blood vessels. The longer you have diabetes, the higher the chances that you will develop heart disease. 4. Stress. Stress has been linked to higher activity in an area of the brain linked to processing emotions, and an increased likelihood of developing heart and circulatory disease. The researchers, from Harvard University, suggested stress could be as important a risk factor like smoking or high blood pressure. This in turn causes the arteries to become inflamed, which leads to heart attacks, angina, and strokes. 5. Abdominal obesity. Scientists already know that stomach fat, known as abdominal obesity, increases the risk of having a first heart attack. But new research finds that having excessive fat in this specific area also increases the risk of subsequent heart attacks. The reason abdominal obesity is very common in people with a first heart attack is that it is closely linked with conditions that accelerate the clogging of arteries through atherosclerosis. Says Dr. Hania Mohammadi, from the Karolinska Institute in Stockholm, Sweden. 6. Sedentary lifestyle. Sedentary lifestyles increase all causes of mortality, doubles the risk of cardiovascular diseases, diabetes, and obesity, and increase the risks of colon cancer, high blood pressure, osteoporosis, lipid disorders, depression, and anxiety. According to WHO, 60 to 85% of people in the world, from both developed and developing countries, lead sedentary lifestyles, making it one of the more serious yet insufficiently addressed public health problems of our time. 7. Eating too few fruits and vegetables. Preliminary findings from the American Society for Nutrition study reveal that inadequate fruit and vegetable consumption may account for millions of deaths from heart disease and strokes each year. The study estimated that roughly 1 in 7 cardiovascular deaths could be attributed to not eating enough fruit and 1 in 12 cardiovascular deaths could be attributed to not eating enough vegetables. 8. Abstaining from alcohol. Drinking more than 3 servings of alcohol per day directly increases the risk of a heart attack. Alcohol abuse increases the lipids in the blood, which is a type of fat that can harden arteries, increasing cholesterol and arterial plaque. Click the link below to understand more about heart attack.